Iya sih. Sure. Thank you, Mr. Babak Asgari, Director of Business Development of Optain Health Australia.
Yeah, thank you for having me.
Yeah, this is a good time
Oh,
me and you join with Mastel.
Sure.
And then I want to know about what is Optain Health's vision when it comes to having artificial intelligence in healthcare.
Sure. So our vision is very simple, but deeply powerful, right? So we want to bring advanced healthcare
Yes.
to everyone. And when we say everyone, we really mean everybody.
In the positive mind.
Exactly. So we're not focusing on big cities, developed countries. We're actually really, our product is designed for underserved communities. For a country like Indonesia, with the geography being such a challenge, right? So we want to put our solution in the hands of everyone in remote areas so that within 2 minutes, they can get valuable insight towards their health, eye health, and cardiovascular.
Yeah, okay. But what's the interactive instructions in healthcare? 9%. Yeah, cyber attack.
Oh, well, it's a thing we have to deal with on a daily basis. It's not specific to healthcare. It's across all sectors. But we have to be aware of the fact that healthcare is one of the most data sensitive basically sectors, right? It's like finance and banking pretty much, maybe even worse, because we're dealing with people's health data. So from our perspective as a business, it is absolutely critical to one, instill a culture of cybersecurity within the organization. So every single staff member's behavior is aligned with our cybersecurity goals.
Yeah.
But also in designing our product, we've been talking about it all morning through the sessions and the panel discussion that product by design has to be safe, right? Compliance is not a box we want to check. Compliance should be worked into every step of developing our product and our processes within our company.
Yes, they protect data, especially for the number of patients, number of social program.
Exactly.
It is a very, very danger if
it is a huge risk.
Yes.
Because obviously giving people data to, for instance, we pick up a retinal image and then on that their health data in terms of do they have any conditions, or how the heart health, eye health, absolutely critical.
And then because the problem is the saviors or protect of data, this is a very high price in the AI generation situation.
Absolutely.
Yes,
That's correct. That's
because
correct.
So I have one interviewer with the cybersecurity, and then it's a very interesting about the human security attempt. Yeah. Basically, so as the AI generation now, it's a human. It's
Correct.
they attack the human.
Sure.
Yeah,
that's absolutely true.
The literacy, digital literacy. Yeah, as you know, it's that. That's
absolutely.
So healthcare is the point of view to attend. I think for healthcare, it's very interesting too.
And critical. It's very interesting, but also absolutely critical because it is very, very sensitive data we're handling on a daily basis. And because of the nature of our product, it could be in the hands of millions of people at the same time. So a company like ours, within our systems, we will very soon have health data of millions of people. So absolutely critical to ensure the government, the hospital, the clinic, and the patient that we are handling your data ethically and with care.
Okay, that Australian, especially the Victoria government. Do you have the ecosystem, government, stakeholders?
Absolutely.
How to defect, influence, analyze, and to make the treat about the cyber attack?
So, I'm not a cybersecurity expert. I'm more of a business leader, but the ecosystem is there. and there is constant audits. As part of the audit, even with the local regulator, they have to provide enough evidence on cybersecurity of our camera, our software, our servers, the whole process. So basically, it is something that is top on the priority list for our government and our local regulator. And we obviously comply with that because we're not in this business for a short-term gain. We're here for long-term partnerships. And we see it as our own responsibility and commitment to the community to ensure and reassure every stakeholder in this game that we are going to be using the data ethically. We're not going to export or do anything that is not ethical.
It means the Victoria government sees the cyber attack is a priority.
They absolutely see it as a huge risk and a priority to mitigate. And we are basically expected to provide all the right measures and evidence that we take it as seriously, and we have a secure system.
Okay. So the next question. In your experience, what are the biggest challenges to adopting AI in healthcare, especially in the emerging markets like Indonesia?
Trust. I would have one word answer to that, trust, but even though it's one word, it's multiple layers. So there's trust from the patient. Is my data secure? Trust from the clinician. Is the output correct? Can I trust the output? And then there is trust from the government and the regulator. Does this work? And is it safe? So basically both of those aspects together. So what we have done and found out is if you bring everyone together in developing, in the design, so have the regulatory input and have the input from the guidelines of the government and put that into your design process of your product, you're basically creating a product that is safe and satisfies the requirements of all of these key stakeholders. That's basically it.
Specifically.
Yes. So we have to address that trust issue, and we're taking all required measures. And I think every other AI in healthcare business has to absolutely be mindful of those.
Little questions again. Okay. Could you tell us more about your AI screening solution?
Sure. So we have developed a retinal screening software. We pair that with a fully automatic portable camera, fundus camera. And what we do is we take a set of retinal images, then AI screens the images for signs of glaucoma, diabetic retinopathy, age-related macular degeneration. And on top of that, we also provide cardiovascular health assessment over a 10-year projection. So that's what we do. And the reason I mentioned a portable automatic camera is because then that creates a turnkey solution that could be put in the hands of almost anyone in a remote area or in an underserved community clinic without the need for an expert on site, without the need for super complex, sophisticated, very expensive and costly equipment. In less than 2 minutes, we can give our patients valuable health insights, right? So that is basically our product and what we're pursuing to also put in the hands of the Indonesian community. Mainly because I mentioned, we understand Indonesia has this geography, but also Indonesia is a very interesting country in terms of the digital ambitions. So, perfect.
The last question. So, about your envision, intelligence, transforming public health system over the next 5 and 10 years, periodically. But it's a very interesting. And what is the role and the responsibility of the government in this matter?
Sure. So in terms of the next 5-10 years, I think we are at a very historic point in time because pretty much in every discipline of healthcare and medical disciplines, we have been talking for quite a long time about moving from treatment to prevention, preventive care, and having not reactive healthcare, but proactive health.
So we need the time to transformation.
Exactly. That time is now because we didn't have the right tools for that transformation to happen. Now, thanks to AI, we do have the right tools. So now is the time that we can transition from treatment and reactive to preventive and proactive care, right? So that's what's going to happen. Absolutely. So that's what's going to happen in the next 5 to 10 years, which is an absolutely amazing transformation, I believe. But we've been talking about the risks all morning. You're absolutely right. The governments have a major role here in setting up very, very clear guidelines for businesses and their expectations in terms of cybersecurity, in terms of how we handle health data.
Especially in healthcare.
Exactly. It's a very sensitive sector, right? To ensure that the players are basically doing the right thing, but also being able to transparently explain our AI.
Yes.
How does our AI make a decision? Not just tell you it works. Exactly.
Safety.
Absolutely. Safety, the decision making, the transparency, and making sure we don't have basically a box checked, like I mentioned, but we have everything sort of incorporated in the design of our product for quality, compliance, security aspects.
Quality. Okay. Thank you very much.
Thank you very much. A pleasure meeting you.
It's very glad to meet
you very
Iranian men.
Likewise. Thank you very much.
Thank you very much.
Thank you. Bye.